Asthma and bronchiolitis are both respiratory conditions, but affect the lungs in different ways and usually target different age groups. Asthma is a long-term chronic disease that causes the airways to become inflamed and narrow, leading to symptoms such as wheezing, shortness of breath, chest tightness, and coughing, especially at night or early in the morning. Bronchiolitis, on the other hand, is a common lung infection in infants and young children and is characterized by coughing, wheezing, and sometimes difficulty breathing due to the inflammation of the small airways in the lung. Treatment for asthma often involves the use of inhaled corticosteroids and bronchodilators to control symptoms and prevent asthma attacks, while bronchiolitis is typically managed with supportive care such as hydration and humidified air, since it is most often caused by a viral infection. While asthma can be influenced by a combination of genetic and environmental factors, bronchiolitis is mainly triggered by viral infections such as the respiratory syncytial virus, RSV. Here's a detailed exploration of the distinct aspects of each disease, emphasizing their unique characteristics, management strategies, and impact on the affected populations. Age group affected, pediatric versus adult. Asthma, chronic inflammatory disease of the airways, often emerges in childhood but affects individuals of all ages. Its hallmark symptoms include wheezing, breathlessness, and a variable course. In contrast, bronchiolitis is an acute viral infection, primarily targeting infants and young children. It's characterized by cough, wheezing, and sometimes difficulty breathing, typically caused by the respiratory syncytial virus, RSV. Asthma is diagnosed based on clinical history and response to medications such as bronchodilators. For bronchiolitis, diagnosis hinges on the clinical picture and age, as it seldom affects those over 2 years old. Unlike asthma, bronchiolitis typically resolves on its own, though severe cases may require hospitalization. Predominant symptomatology: wheezing versus bronchospasm with respiratory infection. Asthma and bronchiolitis are respiratory conditions that both can present with wheezing, but differ notably in their underlying pathology and patient demographics. Asthma, a chronic inflammatory airway disease, often manifests with wheezing due to bronchospasm, where muscles around the airways tighten, making it difficult to breathe. This condition is common in older children and adults, with triggers including allergens, exercise, and cold air. Bronchiolitis, on the other hand, primarily affects infants and young children, typically under 2 years of age. It's an acute viral infection, most commonly due to the respiratory syncytial virus, RSV, leading to inflammation and congestion in the small airways, bronchioles. Alongside wheezing, bronchiolitis symptoms often include a respiratory infection with coughing and difficulty breathing. The diagnosis is clinical, emphasizing the importance of patient history and presentation to differentiate it from asthma, ensuring appropriate management and treatment. Typical onset, chronic with exacerbations versus acute illness. Asthma is primarily a chronic condition characterized by recurrent episodes of wheezing, breathlessness, and chest tightness due to widespread narrowing of the airways. These exacerbations vary in severity and can be triggered by allergens, irritants, or exercise. The pathophysiology involves airway inflammation and hyperreactivity. In contrast, bronchiolitis presents acutely, most commonly affecting infants and young children. It is marked by coughing, wheezing, and difficulty breathing as a result of the lower respiratory tract becoming inflamed, typically due to a viral infection such as the respiratory syncytial virus, RSV. While asthma requires long-term management, bronchiolitis episodes are typically self-limiting, although severe cases may require hospitalization. Common seasonality, all year with triggers versus fall and winter peaks. Asthma is a chronic respiratory condition characterized by inflamed and narrowed airways, with symptoms like wheezing and shortness of breath, often reacting to specific triggers. It can occur year-round, although certain seasonal allergens can exacerbate symptoms. In contrast, bronchiolitis is an acute viral infection common in infants and toddlers. It typically peaks during fall and winter months with the spread of respiratory syncytial virus, RSV, and other pathogens. While both diseases affect breathing, asthma's chronic nature and trigger-based reactions differ from bronchiolitis's acute seasonal infection pattern guiding clinicians in diagnosis and treatment. Primary cause: hyperresponsiveness and inflammation versus viral infection, typically RSV. Asthma and bronchiolitis, while both affecting the respiratory system, have distinct primary causes shaping their treatment and management strategies. Asthma is primarily due to hyperresponsiveness and chronic inflammation within the airways, often triggered by various environmental factors like allergens, causing recurring episodes of wheezing, breathlessness, and chest tightness. Conversely, bronchiolitis is typically caused by viral infections, with the respiratory syncytial virus, RSV, being the most common culprit, particularly in infants and young children. This illness is characterized by acute inflammation, congestion, and mucus in the small airways. Understanding these foundational differences is crucial for healthcare providers to accurately diagnose and tailor treatment plans, whether it's administering bronchodilators and anti-inflammatory medications for asthma or providing supportive care for bronchiolitis.